Senior doctors in Zimbabwe say avoidable deaths during a protracted and ongoing strike are a silent genocide. On September 6th, junior doctors went on strike protesting what they called eroded wages. That action plunged Zimbabwe's health sector into an ongoing crisis. CGTN's Farai Mwakutuya has that story.
More than 400 doctors have been fired for taking part in the strike, which has collapsed the public health system.
The people of Zimbabwe must appreciate that there are no public hospitals at this time. The hospitals are not there. We have these buildings, but they're just buildings and not hospitals.
Specialist consultants who had been treating emergency cases since the industrial action began have now withdrawn their services over delays in addressing their junior counterparts' grievances. The doctors' fight is more than just about money. They're also agitating for better conditions of service inside those wards and for provision of the tools of their trade.
You go into wards which deal with critically ill patients. They have no suction machines for clearing the patient's airway. You go into theatre, you want to do an operation. The most commonly used glove size is size 7 and size 7.5. You are given size 9. These are probably gloves which came in as samples, which are not appropriate. You request for a certain drug, you are told it's not available. You go in to do an operation, you open somebody, right in the midst of an operation, you now want a suture for closing. You are told, sorry, that suture is not available. So choose some compromised one. There are conditions which can be easily treated, which people are actually dying from, because the government is not willing to buy the necessary things, or has neglected to buy the things which are needed in order to be able to run the systems.
The doctors have equated the unfolding emergency to a silent genocide.
We are saying, if the government is not prepared to provide materials that are needed for us to save these lives, then let these patients stay in their homes, let them die in the comfort of their homes, in the presence of their relatives, without us being required to watch them die.
Government insists it can't afford the huge wage demands, but is committed to equipping health facilities. It says it's open for negotiations, but only if doctors return to work, and has invited the dismissed to reapply for their jobs. Farai Mwakutuya, CGTN, Harare, Zimbabwe.